The presence of 11 of 18 tender points and widespread musculoskeletal pain provide the basis for diagnosing fibromyalgia. The American College of Rheumatology established these criteria in 1990 in a multi-centered study. In performing the tender point survey, there are a number of specific factors involved. The purpose of this program is to provide a standardized technique for the 1990 ACR Manual Tender Point Survey. We will demonstrate the pressure application technique, define the precise identification of survey sites, and review the complete manual tender point survey, including the standard examination procedure and patient instructions.
The standard procedure for applying pressure in the manual tender point survey requires you to use the thumb pad of your dominant hand during the examination. Locate the survey sites first visually and then with light palpation. Always apply thumb pad pressure perpendicular to each survey site. During the exam, press each site only once for 4 seconds. Increase the force by 1 kilogram per second until you achieve 4 kilograms of pressure. When applying the proper force, there is usually a whitening of the examiner's nail bed. Learning the feel of 4 kilograms of pressure involves the use of a standard clinical scale or a dolorimeter. First, set the scale at the weight of the practice subject. Then, add 4 kilograms to the balanced subject's weight. With the thumb pad of your dominant hand, apply perpendicular pressure at the trapezius tender point site. Bring the scale back into balance. Another way to practice the correct feel is with a standard dolorimeter. By practicing with a clinical scale or dolorimeter, you can easily learn to apply 4 kilograms of pressure. To increase survey consistency, observe the following guidelines. Perform the manual tender point survey at the beginning of the physical examination. The patient should wear a standard gown and sit at the front end of the exam table. Use a scoring sheet to record the results of the examination. At the start of every exam, explain the procedure to the patient. Read the printed statement from the scoring sheet to assure standardization.
Various areas of your body will be examined for pain. Please say yes or no if there is pain when I press a specific point.
I can do that.
Okay.
You can measure the patient's perception of pain at survey sites by using a 0 to 10 scale. Read the following explanation of the scale to the patient.
I want you to rate the intensity of the pain on a scale from 0 to 10. 0 is no pain, and 10 is the worst pain that you have ever experienced.
Okay.
During the course of the examination, remind the patient of the meaning of the pain scale. It reinforces their understanding of the range. Examine the 18 tender point sites and 3 control sites in the designated numerical order. This helps to maintain uniformity. The purpose of the control sites is to provide a baseline measure of the patient's pain perception. A diagram similar to this appears on the recording form. Follow the numerical sequence. The patient's position on the exam table can also influence survey results. For survey sites 1 through 17, the patient should sit on the end of the table. Perform the survey of tender points 18 and 19 with the patient lying on her side. And for tender points 20 and 21, the patient should lie on her back with her feet slightly apart. The manual tender point survey begins with the first control point, the forehead. Examine the patient with her head in the neutral position. Start by placing a supporting hand at the back of the patient's head. Press your testing thumb pad at the middle of the forehead, increasing the pressure to 4 kilograms over 4 seconds.
Was that painful?
As you remove your thumb, ask the patient, "Is that painful?" After the patient responds, ask her to please rate the pain from 0 to 10. If there is no pain, the score is 0.
Tell me they don't.
Record the response on the scoring sheet immediately after testing the site.
No real right or wrong.
At times, the patient will be unable to tolerate 4 kilograms of pressure. Note this response on the recording form and still ask the patient to please rate the pain from 0 to 10.
What is important to you?
For tender points 2 and 3, the patient should loosely flex her head forward.
That's fine.
Stand to the side and behind the patient. Support the forehead with your non-dominant hand and move your examining thumb up the midline of the neck to the nuchal ridge. Move laterally 1 thumb width to the insertion of the suboccipital muscles on the occiput. Press at this point just below the nuchal ridge. The trapezius muscles are the location for tender point exam sites 4 and 5. The patient's head is again in the neutral position.
Allow your shoulders to
Stand to the side and behind. Identify the midpoint of the upper border of the trapezius and press down.
Now I'll do the other side. Loose again, just looking straight ahead.
Locate exam points 6 and 7 at the supraspinatus muscle. Again, position yourself to the side and behind the patient.
You'll feel my hands on your back.
You will find this tender point area immediately above the scapular spine near the medial border of the scapula.
Same thing now on the other side. Was that painful?
Again, no.
The medial gluteal muscles are the sites for tender point exam spots 8 and 9. While positioned at the side and behind the patient, place your examining hand loosely on the lateral iliac crest. Locate the survey site by allowing your thumb to fall naturally on the gluteus medius. The location is slightly anterior to the gluteus maximus.
And rate that, please, on the scale from 0 to 10.
I'd have to say also.
All right. Other side now. Just moving your gown a bit.
The tender point survey now moves to the patient's front side. Position yourself to the side of the exam table to survey sites 10 and 11, the lower cervical area.
Survey. I move to the front of your body. I want to remind you that the scale from 0 to 10 is one where 0 is no pain at all,
Right.
and 10 is the worst pain you have ever experienced.
Okay.
You clear on that?
Sure am.
Okay, well, we can go ahead then.
Okay, thanks.
First, identify the tip of the mastoid process and the cricoid cartilage below the thyroid cartilage, C6. The survey site is straight down from the mastoid process at the level of the C5 to C7 vertebrae. As you test sites 10 and 11, be sure to support the opposite side of the neck and press in the direction of the opposite shoulder. The manual tender point survey continues to the second rib for sites 12 and 13. From the side of the exam table, start the survey by locating the sternal notch. Move down to the angle of Lewis, the level of the second rib. Then move 1 thumb width lateral to the manubrium sterni. Press the upper border of the second rib while supporting the patient's back with your other hand.
Now I'll do the other side. Was that painful?
Yes.
Tender points 14 and 15, the lateral epicondyles, are the next survey sites. Start by standing at the side of the exam table and ask the patient to place her hands, palms down, on her lap.
You'll feel my hand.
Support the forearm with your non-dominant hand. At a point 2 centimeters distal to the epicondyle, apply the test pressure.
Now I'll do the other side. Same thing, just be loose. Was that painful?
Yes, it too was.
And on the scale from 0 to 10, how do you rate it?
4.
Tender point 16 is a control point on the right forearm. With your non-dominant hand, support the patient's forearm and apply pressure at the junction of the distal and middle 1/3 of the dorsal forearm. The third control point, point 17, is located on the left thumbnail.
The next survey
While the
site
patient is
palm of
sitting
your
on the
left hand.
exam table, support her thumb
Just
in the
place your
palm of
thumb
your
on that palm.
non-dominant hand.
Rest your hand back on your
Press
lap.
the entire nail area of the left thumb and record the patient's response.
Was that painful?
Nope.
To test tender points 18 and 19, the greater trochanter,
Lie
the
down
patient should lie on
and
her
roll towards
side
the
with her
far
upper
wall.
leg flexed forward.
Keep you covered for monitoring.
Position yourself to the side of the examination table.
I'm going to uncover you a little. You'll feel my hand on your hip.
Apply perpendicular pressure, 1 thumb width, posterior to the trochanteric prominence.
Now I'm going to examine the survey site on the other side. And to do that, I'll need you to roll over. That's fine. Uncovering a little bit again. You'll feel my hand on your hip. Was that painful?
Yes.
The knees are the location for the final pair of tender points.
To test the next
To
survey
test sites
site,
20 and
I
21,
need you to
the patient
separate
lies
your
on
feet.
her back with her feet apart.
You'll feel my
While
hand on
standing at
one
the side of the
your knee.
examination table, apply 4 kilograms of pressure directly above the joint line at the medial fat pad.
Now you'll feel my hand on your other knee. Was that painful?
Yes, it was.
Please rate.
Here is a review of the general procedures of the manual tender point survey.
Various areas
Follow
of
the
your body
examination
will be examined.
procedure, including an
Please
explanation
say
of the
yes
standard
or no.
patient
If
instructions.
there is pain,
The patient should wear a standard gown for the examination. Examine the survey sites in numerical order. Locate each survey site visually and with light palpation. Use the thumb pad of your dominant hand throughout the test and apply perpendicular thumb pad pressure to each site. Press each survey site once for 4 seconds. Increase the thumb pad force by 1 kilogram per second and immediately record each response after you test the site.
just sit loosely.
By practicing the techniques and following the guidelines outlined in this program, you should be able to accurately identify the number of positive tender points, assign a severity score to those tender points, and assess the patient's baseline perception of pain through the use of control points.